Yes, ma'am.
You're ready? Okay.
Yes, ma'am.
Right. So if you have read and understood, considering it surgical pathology station, please, what is your differential diagnosis?
My provisional diagnosis is osteomyelitis, and the differentials are septic arthritis, osteoarthritis, gouty arthritis, hemarthrosis, and trauma.
Okay. What are the most common organisms that can lead to this condition?
The most common organisms are Staphylococcus aureus.
Okay. Yes. Right. Please tell me the pathogenesis behind the formation of osteomyelitis. The steps.
Yes, ma'am. There are 5 main steps that are involved in the pathogenesis of the osteomyelitis. First one
Yes.
is invasion and inflammation.
Yes.
Next is necrosis. Next is suppuration. Third is necrosis. Fourth is new bone formation, and the 5 is resolution.
Okay.
And
There are certain terms that I would want you to tell me what you understand by involucrum.
ma'am, involucrum is basically reactive woven or lamellar new bone formation forming a shell of a living bone around the screstrum. This is called
And
involucrum,
what
or it can
is,
also be,
yes, and what is
yes, ma'am.
questrum?
Screstrum is a dead bone that has become separated from the normal tissue during the process of osteomyelitis.
And okay, something which is because of compromised blood supply of the bone leading to necrosis that leads to the
Yes,
formation of questrum. So what is necrosis, if you could please define?
yes, ma'am. Necrosis is unregulated and unprogrammed death of the cell, which is due to caused by the disruption of the membrane and loss of iron hemostasis.
Okay. How would you, yes, if you could define the death, cell death, or what are the different types of necrosis? How would you classify them?
Yes, ma'am. There are 6 different types of necrosis: uh, coagulative necrosis, liquefactive necrosis, caseous necrosis, fat necrosis, gangrenous necrosis, and fibrinoid necrosis.
Okay, which type of necrosis takes place in osteomyelitis, please?
Uh, Coagulative necrosis.
Yes, most likely. Right, please tell me, right, how does the organisms infect the bone, or how this spread takes place at
Yes, ma'am. Yes,
cellular
ma'am.
level?
There are 3 modes of spread. First one
Very
is
good.
hematogenous spread.
Yes.
Second one is direct infection of the bone by the pathogenic organism. Third is indirect infection of the bone by the surrounding necrotic tissue. From the surrounding necrotic tissue, the bacteria can infect the bone.
So give me please one example of hematogenous spread.
Uh,
Most
like
common cause is,
like bacteremia. Bacteremia may be infection in the blood that can spread to the bone.
or even
And
it
the
could
most
be
common
even
one is
cellulitis. Yes. Okay.
it causes cellulitis and inflammatory changes in the skin and subcutaneous tissue as well. And the most common one is Staph aureus.
Okay. All right. If you could tell me, how would you manage this patient next?
Yes, ma'am. As this is a case of osteomyelitis, so I have to inform the infection control team first, and after that I will discuss the case with the microbiologist.
Yes.
Third, I will follow the infection protocols, and after that I will take a swab from the pus and cultures, take a swab of the pus for the culture and sensitivity. After that, I will take the blood culture, and after taking the blood culture, I will give a broad spectrum antibiotics that will kill the Staph aureus, Streptococcus, and along with that enterococcus. And the options for these antibiotics are cephalosporins, comoxiclav, and this is a combination of amoxicillin and gentamicin. So after the antibiotics, I would like to do supportive treatment such as for pain and for hydration. And after that, I will do the supplementation of the limb. And the last point is if the infection is not resolving after 2 days, maybe there is a need to do incision and drainage of the abscess.
Okay. Please tell me, why is it important to remove the fixed plate which patient
Yes, ma'am.
has?
Because yes,
Yes.
the patient has fixed plate, which actually acts as a septic focus.
Yes.
So, or maybe sometime due to osteomyelitis, it will become loose. And third possibility is that the bacteria will form biofilm on it, and the antibiotics become resistant to kill the bacteria.
Okay. Just suppose patient has not been removed the plate, and the plate becomes septic. Patient comes to
Yes,
you.
ma'am.
What condition patient can or is most likely to develop?
Yes, ma'am. It will actually develop chronic osteomyelitis.
Mm, it has become septic now due to chronic irritation or chronic inflammation. This can lead to development of squamous cell carcinoma.
Yes, ma'am. Yes.
Yes. Okay. What treatment can we offer to the patient with osteomyelitis? Would you consider giving antibiotics?
Yes, ma'am. After taking the culture and blood culture and the pus culture, I would like to give broad spectrum antibiotics to cover the infection,
Okay.
prevent the further spread.
If there is no infection, no sign of active infection, how
Yes,
would
ma'am.
you think of, would you still consider giving antibiotic to the patient, or would you just would remove
Yes.
the foci and do the surgical drainage alone?
Yes, I think if there is no sign of infection, and if I can't be able to find any bacteria on the culture, then surgical drainage is the only option we will follow.
Okay, just suppose you've already treated the patient, gave the antibiotics, patient is not responding, and
Yes, ma'am.
2 days has gone, and
Yes, ma'am.
there is no improvement in the patient's
Yes,
septic
ma'am.
focus. How would you go about? What would you do next?
So I will discuss the case with microbiologist and infection control team, and after that I would like to find out the focus. If we can't be able to find the focus, I would like to do CT scan to find out where is the abscess. And after that, if the I can find the obvious abscess, we can do ultrasound guided drainage, or we can do surgical drainage as well.
Yes. Okay. One last time, please tell me the pathogenesis of hematogenous osteomyelitis. From where exactly the blood vessel enters and how it
Yes, ma'am.
carries and exactly everything, please.
Yes, ma'am. The blood vessels which are carried this is basically metaphyseal arteries, which
Yes.
are located into the metaphyses, and because
Yes.
the specific nature of these arteries actually cause the turbulence of the blood and the bacteria to lodge over there. And after when the bacteria will become a focus over there, this leads to acute inflammation and suppuration, and the abscess will spread along the workman's canal and cause the periosteal elevation and cause dead necrosis and sequestration and the dead bone formation.
Yes. Okay. Good. What is the reason why this area becomes a focal point for the bacteria? What is the reason behind
This
it?
The reason behind is metaphyseal arteries. Yes, ma'am. Actually, metaphyseal
Because,
arteries loop around the growth plates and form some
yes,
irregular pattern which cause the
no
turbulence of the
matter,
blood.
yes, no matter what happens, still in that lining, there is no phagocytic activity, no phagocytic cells. So
Yes, ma'am.
that's why that is
Yeah, very
the
little.
focal
Yes, ma'am.
point. Yes, good. Right, thank you.